Jen Redfern from Plus Health Company here. We're just going to spend a few minutes looking at some exercises you might like to try on your back. These are appropriate for people with acute back issues, but also early post-spinal surgery as well, and just if you're feeling a little bit stiff and you want to have a little bit of a loosen up. So ideally, you'd be laid on the mat, on the floor, rather than on your mattress. But if it's difficult for you to get down and then back up off the floor, then the bed is a fine place to start until you're ready to progress. If you find it difficult lying flat for any reason, then by all means prop yourself up with cushions and pillows so you're in an inclined position rather than a horizontal one. So as you do, bring your weight onto your back. Let's assume that most of us can do that. I'd like you just to spend a moment to think about how you're laid. So thinking about your feet being hip distance apart, visualise that you're on double yellow lines and they're coming through the feet, knees, hips and shoulders on each side. Consider how you're sharing your weight through the back of the head, through the lower rib cage, the pelvis and the feet also. Try and evenly share your body weight across those areas. If you feel like your back is very arched and your ribs are flaring upwards, then lift your head and shoulders, give the shoulders a wriggle and then rest back down, and that should help. Now once you've got balanced along your body in this position, bring your hands towards your lower tummy. Become aware of your breath. And as you next breathe out, just see if you're able to lift your lower tummy muscles away from your hands. So it's a bit like your hands are feathers and you just want them to almost get a sense of floating above your tummy, and then let go. And again, gently draw your lower tummy away from your hands and let go. So this is centering with your lower abdominal cue, and it helps to support and create a bracing support really for your torso and through the pelvis. Maintain that gentle support as best you can, so about 30% of a maximal effort, and then bring your arms beside you. Imagine you have a tray of drinks rested across the front of your pelvis, very expensive ones which you're trying not to spill. And as you think about that, I'd like you to imagine you are on a beautiful sunny beach. You're going to draw a groove in the sand with one heel as you glide your heel away, only to a point where you're able to keep your tray of drinks steady and your back nice and still, and then return back in. So that may not be to a straight knee position, but then it might also be as well. As you breathe out, slide the leg away, repeating that groove in the sand over and over and alternating across sides. So you're teaching your body that you can move from your hip and into your leg without your back always getting involved. Sometimes people with back problems have pain because they're overworking through that area so much of the time. Now let's imagine we're still on a beautiful sunny beach. One can only dream. And imagine there is a cocktail upon the top of one knee, in addition to a whole tray of lovely drinks across the pelvis. Now allow the other knee to float outwards to the side, keeping those other areas still, and then return back in. Use the same leg again. As you breathe out, float out. And as you breathe in, return in. Now with this exercise and with the previous one, it might be useful to start with up to 5 repetitions and gradually increase towards 10 as you feel comfort and control allows. Do the same for the other side when you've completed your set, and notice if there is more or less challenge to keeping the supporting leg steady and the pelvis really balanced, because it might be, especially if you've had long-standing problems, that it does feel different on one side. Next, I'd like you to bring one leg through to what we refer to as the tabletop position. And now you'll need to imprint. So think about drawing in a little more firmly from your tummy muscles and connecting your lower back a little bit more towards the floor, and add the second leg. And then bring the first one back and second to follow. This time lead with the other leg. As you breathe out, lift. Hold as you breathe in. As you breathe out, lift. Hold as you breathe in, and as you breathe out, rest the legs one at a time. As you do that, you should start to observe a little bit more effort in your abdominal muscles. It should not feel to make you uncomfortable in your lower back at all. If it does, think about connecting the lower back a little bit more firmly towards the mat. And if it's too much for you just yet, then omit it and let us know. Let's try 3 or 4 of those, leading with each leg, there and back. And then bring your knees and feet together. So imagine that they've been zipped to one another and cannot be separated. Take your arms a little further from your body with your palms upwards facing, and let's move into hip twist. So as you breathe out, send your knees across to one side and allow your buttock to lift, your waist, and then your ribs to follow, but keep the shoulder blade anchored and then return back to the start. Do the same across to the other side, only moving as far as comfort and control allows. So you're never pushing into pain and discomfort or allowing your legs just to flop to the side. This can be a really nice one for helping to mobilise a stiff back, particularly in the morning before you get out of bed, just to get oiled and greased a little bit more, ready for the day. Try 3 or 4 of these to each side, and then bring one leg in. Just give it a little cuddle. If it's difficult to hold at the shin, go behind the thigh and then switch. This starts to create a little bit of stretch, gentle stretch across your lower back and the back of the hip as well. And it's important that we have both flexibility and strength and endurance, not just one or the other. So bring each knee in towards your chest 2 or 3 times, and then if it's comfortable for you, bring them in together. Just make yourself as small as you possibly can, and that may feel to enhance the stretch across the lower back and the buttocks. Again, no forcing, just to comfort and control. Then rest one leg away and keep hold of the other behind the thigh. Now lengthen and bend the knee. It's a bit like if you were in the can-can. And as you do it, be aware that your head and neck, your shoulders feel as relaxed as possible, so you're not feeling to lift the head and the shoulders away from the floor. Now this is really useful for lots of reasons, but one is to help to mobilise the neural tissue in the leg, as well as the myofascial tissue that connects from the sole of the foot at the back of each leg, along the spine through to the top of the head. You could try 5 or 6 of those and then do the same on the other side. And it might be, if you have a history of issues such as sciatica or hip and knee problems, that you feel it's very different on one side to the other. So it's useful to continue your practice until it feels much more like the other side. You should not feel worse after doing this or in any of the exercises. Now when you have those, the final little exercise is just to cross your ankle towards your knee and then bring the knees in towards your chest, wrapping your hands around the back of the unfolded leg. Now if it's difficult for you to do that, just position the hand at the knee and the ankle and draw them in as comfort and control allows. And it might be that again this feels quite difficult for you, and if it does, you'll probably also observe that getting your shoes and your socks on is tricky as well. Do the same on each side and hold each side for a position of breaths for 2 to 3 breath cycles. Keeping as relaxed as you can around your head and shoulders as you do. And hopefully those little exercises will just start to get your stabilising muscles a little bit more active, a little bit more alert, but also start to mobilise your spine as well. Help you gain confidence in your movement again and feel all the better for it. So thanks for tuning in. Until next time, bye for now.